Welcome back to the channel. This is Dr. J. Today I have a compilation of 4 different patients for you, and it'll be mixed with some of my narration as well as some uh, unedited audio from the patient encounters for you. Um, this first patient is an elderly gentleman brought in with his wife for concerns of hearing loss. His baseline is one that he already has hearing loss and he utilizes hearing aids. However, when he develops a cerumen impaction, this inhibits the hearing aid from working appropriately and can create a lot of reverberation and complicate the amplification that comes from his hearing aids. And so as you can see on his right side, he had an occlusive cerumen impaction. It's very dry and flaky, and just lifting it up from and away from the ear canals. And here I am trying to use the Takahashi forceps to complete the rest of what would be squamous keratinous debris from the ear canal, so that we could see the eardrum freely. And once you remove this from the ear canal, the hearing aid is then able to perform its intended purpose more readily, and without the reverberation and without the obstruction. Now on the left side, he again has some cerumen impaction, and he also has a large buildup of squamous keratinous debris that starts to create a problem for him. I guess I shouldn't say it creates a problem for him. More so, it creates a problem with trying to continue the debridement. His reaction to that part of the procedure actually prohibits us from continuing it and doing a full extensive skin peel on this side and completely cleaning out the left ear canal. For some background, we have 12 cranial nerves. The 10th nerve, which is a paired nerve, we have one on each side, is called the vagus nerve. It does a lot of wonderful things for our body, but one of the things that it does is it has a small branch that goes to the ear. And if it is stimulated enough, it can actually make it feel like there is a feather tickling the back of our throat and initiates a coughing reflex. You've probably already heard of this before. If you watch these videos regularly, you are aware of what that nerve is and what it's called. It is the auricular branch of the vagus nerve, or the eponym is Arnold's nerve. Here is his ear cough reflex, rather severe reaction.
Sympathetic response.
Yeah, sorry about that. That's me.
What happens?
If you touch the ear in the right place, it makes you cough.
Yep. Okay.
I feel bad for the patients who have this severe of a reaction. The best you can do is get rid of what you can get rid of, start some topical therapies for the ear to try and help the skin and the earwax migrate normally without having to manipulate their ear canal on a frequent basis. He was a champion through it all, and he sat still as best that he could. But sometimes reactions are just so severe it's not safe to be in the ear canal anymore. I got what I could out of his ear, and that'll buy him some time with his hearing aids, and he'll come back to my office as needed. I usually see them back about every 6 months. Patient number 2. This is something we see quite regularly in our office when we have patients that come in. They have long-standing hearing aid use. Occasionally, the hearing aid domes or the tip of the hearing aids wind up getting stuck in the canal for a variety of reasons, and sometimes they just have to be removed. In this scenario, the patient came in, he knew what was in his ear, he pulled his hearing aid out and noticed that the dome was not on the tip of his hearing aid, and so in that scenario, it's pretty easy to know where the dome is. It's resting in the ear canal. And fortunately, with our instrumentation we have in our office, we can take these out for him fairly easily. It's a very quick procedure. Depending on how deep it is and how long it's been in there, it can be relatively painless or a little uncomfortable. For this gentleman, it was a little bit uncomfortable, as deep as it was in the ear canal. My record so far is 3 dome tips in the ear canal at one time. I hope I don't break that record for the patient's sake. That's a lot. The ear canal is a little irritated, but he'll do just fine. This is patient number 3. I'm going to sit this one out. I'll let you listen to the encounter. Very sweet elderly patient who uses hearing aids. I'll be back in a moment with patient number 4. The patients are able to watch the procedure while I'm doing it live on a monitor right next to my exam chair where I'm performing the procedure.
Boy, that stuff looks like it's really hardened in there, doesn't
It can,
it?
yeah.
Yeah. Oh, no wonder I have been having trouble hearing. My goodness. I don't know if this one has more crooks in the ear canal or not, but
It's pretty close to the same.
Well, how often should I get my ears checked for wax? Is that something like I could come in every 3 months and just have a nurse look at them?
So, I don't have any providers like nurses to do that. I have medical assistants, but they're not trained to do exams like that. What we can do is say we can see you back in like 6 months, and see how you're doing.
Okay.
And then if it needs to be more frequent, we can always
All right, everybody, we're on to patient 4. This is also something that we perform regularly in our office, is ear cleanings for those who cannot care for themselves. And in this particular patient, they have a condition, a syndrome, of which the ear canals are small, and it is a constant issue that these patients have to deal with, or their caretakers have to help them deal with. And because the ear canals are smaller, then they'll need a little more attention than the average person. In this patient, you can see that the ear canal is very moist. The patient had been pre-treated with earwax softening drops prior to coming to my office. It's really helping move things along very quickly, very easily. This right ear was cleaned up very quickly. He had Cerumen Impaction. It was kind of clumpy, but it all came out in big pieces, which makes our job very easy. And that last piece was all the way down, almost resting on the eardrum. And on his left side, you can see that, again, the ear canal has already previously been treated with topical agents. The wax is very moist, almost oily in appearance. And as we're working, you know that the ear canal is a very sensitive place. It's one of our main senses, and with that comes a skin that is just absolutely loaded with sensory fibers. So you have to be very careful in the ear canal. It's a very sensitive place. This piece came out relatively easily in an all-in-one piece. It really makes our job easier when that happens. Fairly large piece, and when we go back in the canal here, we can see that that was it. That was just that one large piece. As we go back in the canal, we do just a little bit of touch-up work. No reason to do anything extensive on these patients. They are frequent patients, and we have them coming back every 6 months, 3 months, or even every 12 months if needed. We tend to do whatever their ear canals require. We tend to have them on earwax softening drops 1 to 2 times per month, and that helps keep things moving normally. And there we go, normal tympanic membrane. It looks nice. And thanks for sticking around to the end. I really appreciate you. Thanks for your time. And as always, thanks for watching. We'll see you on the next one.